Hello and welcome. Good morning, all. My name is Jenna Sistad, and I am the project manager of the Ocean Monmouth Health Alliance, which many of you know, is our region's cancer and chronic disease prevention coalition. We host this series once a month called Our Health to Hold. We do it virtually, and we invite community partners such as yourselves to come out and present on the wonderful things that their organizations are offering, and also do a little bit of education around the National Health Month. So today we have Giovanna from our New Jersey CEED team here in Monmouth and Ocean County to talk with us about what CEED does, what her role is, and also about ovarian and prostate cancer this month. So thank you, G, for being with us. I'm going to toss it over to you.
Thank you, Jenna. Good morning, everyone. My name is Giovanna Zacatalco, and I'm one of the bilingual patient navigators at NJCEED. And as Jenna said, I'll be speaking about what our program does, how we can help our community, and a little bit about National Ovarian and Prostate Cancer Awareness Month. So New Jersey Cancer Education and Early Detection, or the NJCEED program, provides free to low-cost screenings for breast, cervical, colorectal, and prostate cancer. We provide these screenings for uninsured and underinsured Monmouth and Ocean County residents ages 21 to 64. It is also important to know that NJCEED is a non-reporting program, so we do also provide services for undocumented folks, so there should be no fear of us sharing any of this information with government agencies. We have case managers and patient navigators that will help facilitate appointments, transportation to and from, diagnostic workup if necessary, and referrals into treatment. We're affiliated with FQHCs and hospital networks, imaging centers, and specialty providers across Monmouth and Ocean counties. And although our NJCEED program is geared towards Monmouth and Ocean County, NJCEED is available through all of New Jersey. So we provide screening services for women that include clinical breast examinations, mammograms beginning at age 40, pap smears beginning at age 21, pelvic exams, HPV tests, FIT or FOBT tests, which are fecal occult blood tests. They detect blood in your stool that is not visible to the human eye. We also provide diagnostic testing if the results of any of these exams are abnormal, and referrals into treatment if diagnosed. We provide screening services for men that include the PSA test, which measures the amount of prostate-specific antigen in your blood, prostate exams for men 55 years and older, with emphasis on African-American males being tested a little earlier at age 45. We also do FIT and FOBT tests for men, diagnostic testing as well, and referrals into treatment. So if you are diagnosed through CEED, we connect you with one of our clinical case managers. And although most of our population comes in without insurance, we are able to apply for an emergency CEED Medicaid that will lessen the financial burden of treatment for those who receive a breast or cervical cancer diagnosis. And most of our population is undocumented and unfortunately not eligible for this Medicaid because of their legal status, but we do try to accommodate and help them connect to a hospital where they can receive charity care. We connect them to those patient navigators so they don't feel alone in this tough process. As mentioned before, we also provide transportation via Uber Health. We are able to assist individuals with an Uber ride to and from their scheduled medical appointments. We have bilingual staff, including myself, that can help non-English speaking patients set up these appointments. And now let me get into September, which is a National Ovarian and Prostate Cancer Awareness Month. Both of these cancers are two hormone-related types of cancers with high incidence. These types of cancers are united by a lack of symptoms in the early stages. Prostate cancer is ranked fifth in cancers among men, and ovarian cancer is also ranked fifth in cancer deaths among women. These statistics are for men and women in the United States. In both cases, early detection and diagnosis allows for more treatment options, increasing the chances of survival. Routine checkups are encouraged for successful prevention. So before I get into the specifics of ovarian cancer, I just wanted to let you guys know, if you don't already know, that normal healthy cells grow, divide, and die in a controlled process, whereas cancer cells are different because they grow out of control and divide into new abnormal cells. They outlive the normal cells and lead to the growth of a tumor that can spread to other parts of the body. So ovarian cancers include cancers that start in the ovaries, the fallopian tubes, and the lining of the abdomen. These types of cancers behave similarly and they are treated similarly, so they are grouped together. Anyone with ovaries is at risk of ovarian cancer, but there are certain risk factors that can increase your chance of developing ovarian cancer. These risk factors include getting older, being overweight or obese, having a child later in life, or never having a full-term pregnancy, family history, and smoking. Common symptoms of ovarian cancer include bloating, pelvic or abdominal pain, trouble eating or feeling full quickly, and increased urinary frequency. It is important to pay attention to your body and know what is normal for you. If symptoms do not go away within 2 weeks following normal interventions such as rest, change of diet, or exercise, you should definitely contact your doctor. And although there is no known way to prevent ovarian cancer, there are certain things you can do to reduce your risk, including taking birth control pills, childbirth and breastfeeding, and of course, surgical options for those who are at a higher risk. So unfortunately, there is no single screening test for ovarian cancer. Diagnosis includes a combination of medical history review, physical examination, imaging tests, and laboratory tests. So ovarian cancer can be detected through pelvic exams that are performed by a physician to feel the uterus, vagina, ovaries, bladder, and rectum for any unusual changes in shape or size. Transvaginal ultrasounds are performed after an abnormal pelvic exam to look at the ovaries and uterus. However, a biopsy is the only way to definitively diagnose ovarian cancer. A biopsy removes tissue or cell samples for a pathologist to examine. And once diagnosed, treatment includes chemotherapy, immunotherapy, hormone therapy, radiation therapy, and surgery, which includes fertility sparing surgery. So what this means is that if you still want to have children or begin a family, you can do so. If, for example, the cancer is only in one ovary and the other is intact, the surgeon may just be able to remove that one ovary with the tumor in that fallopian tube on the same side, leaving the other side, the ovary and the fallopian tube intact. So prostate cancer, the prostate is a small walnut-shaped gland in males that produces the seminal fluid that nourishes and transports sperm. Many prostate cancers grow slowly and may need minimal treatment or even no treatment at all. However, other types of prostate cancers are aggressive and can spread quickly. And this cancer is also primarily a disease of aging. Race and genetics also play a significant role. If you're African American, your chances of developing prostate cancer are double those of white men. If your father, brother, or multiple blood relatives had prostate cancer, you're more likely to get it too. Poor eating habits and diets that heavily rely on fats and animal proteins can cause DNA damage and lead to cancer. And unfortunately, there aren't any early warning signs for prostate cancer because anatomically, the prostate gland is not near anything else that if it does have a tumor, it'll push against and cause you pain. So that's why screening for prostate cancer is such an important topic for all men and their families. Signs and symptoms include blood in semen or the urine, urinary difficulty or increased frequency, pain in the spine, hips, or ribs, and erectile dysfunction. There are things you can do to change your risk factors, including diet and lifestyle. Some experts suggest that differences in the Eastern and Western diets are to blame for the higher incidence of prostate cancer amongst American men versus Asian men. So even men who are already at greater risk for prostate cancer due to age, race, or genetics can reduce their chances of developing prostate cancer by adopting healthy diets and lifestyles that include reducing fat intake, avoiding charred meat, and incorporating fruits and vegetables, exercising to maintain a healthy diet, and staying sexually active. For prostate cancer, the prostate-specific antigen or PSA test is the gold standard for screening. Oops, sorry. There we go. PSA or prostate-specific antigen is a protein produced by the prostate and found mostly in semen with very small amounts released into the bloodstream. So when there's a problem with the prostate, such as the development and growth of prostate cancer, more PSA is released into the bloodstream. A physician may consider several factors when evaluating the PSA result, such as age, if you had any previous PSA exams.
Want to walk at 10:30?
And subsequent to a PSA screening and based on the results, supplemental tools like a digital rectal exam, imaging tests, and biopsy can help determine a cancer diagnosis. Treatment includes radiation therapy, hormone therapy, chemotherapy, surgery, and active surveillance. And as mentioned throughout this presentation, genetics play a big role in both of these diseases. Studies show that inheriting a gene mutation can increase the risk of cancer. Mutations in the BRCA1 or BRCA2, which stand for breast cancer genes 1 and 2, can increase the risk of developing breast, ovarian, and prostate cancers. Also, if you're of Ashkenazi Jewish descent and have a close family member, like a parent, sibling, or child with breast or ovarian cancer, it might be good. It might be a good idea to get genetic testing. Black men are also at a higher risk for prostate cancer. And while genes, hormones, and diets are a big factor, Black men also have less access to prostate cancer treatment and experience longer delays between diagnosis and treatment. We also can't turn a blind eye to the racial disparities evolving from institutionalized racism, which include generalized mistrust in the healthcare system, poor physician-patient communication, lack of participation in clinical trials due to bias from the healthcare providers to recommend these methods. Lynch syndrome is the most common hereditary colorectal cancer, and people with this disease are more likely to get ovarian and prostate cancer. If you have family history of any of these cancers or any of these diseases, you should definitely consult your doctor about genetic counseling or genetic testing. And lastly, not all mutations are gotten from your parents. Some of them are acquired mutations throughout our lifetime. So this can depend on a various of factors, such as chemicals that we're exposed to, environmental factors like pollution, our diets, if you smoke or drink. And luckily for us, our body is capable of fixing these mutations. But if the factor that is causing them is not taken out, unfortunately, it does come to a point where your body cannot change them. And that's where the tumors and cancers come into play. And these are my sources for you guys if you want to read a little bit more about ovarian and prostate cancer. The last one is also a link to our NJC location sites across New Jersey with phone numbers and addresses in case you guys have any patients or know of any family members or friends that may need this service that are not in Monmouth and Ocean County. And now I want to open the floor to having an open discussion about this. If anybody has a personal story they would like to share or has any questions about what NJC can do, please feel free.
Thank you, Giovanna. It's a great presentation. I say this all the time that although I hear CEED present often in the community, there are always new things that I'm learning when I hear you all talk. So thank you. It's a manageable group
Yeah.
today. So if anybody has anything they want to share, like Giovanna said, if you want or a question, you can take yourself off mute or certainly feel free to put it into the chat box. Raven, thank you for saying that. Raven said, great
Thank you.
presentation, good information. Yep. Gee, I had a question or maybe a clarification. So
Sure.
I get a lot of people talking to me about transportation. And I know that Seed is able to offer transportation through the Uber Health relationship that we have. So, can you talk a little bit more about the types of transportation that we're able to provide? I know that at one point we were doing a whole lot more than we're able to do now based on our state outline. So, if you could maybe specify where the things we do provide transportation for versus the things we don't at this point.
Of course, yes. So we provide transportation for mammograms, GYN appointments, pap smears, initial consultations with a gastro for a colonoscopy. So we are able to provide rides for most of the screening appointments. The only time we cannot provide a ride is if the patient is receiving some sort of anesthetic. So at the actual office visit where they're getting the colonoscopy, they will have to go on their own and take someone they can trust with them. But that's pretty much the only time that we cannot provide a service, I mean, a ride. And obviously, the services they're getting, they have to be CEED services. So if they're going for a general checkup or a physical, unfortunately, we cannot provide a ride then.
Excellent. Thank you for saying that. Anybody else have a question or something that they would like to share? Okay. All right. So I would like to say thank you again. Many of you know my mom is an ovarian cancer survivor. And so this month we do a lot of celebrating and educating. And so I was really thrilled to be able to provide this presentation today. And Giovanna, I can't tell you how appreciative we are to have you to do this today. Thank you.
Thank you, Jenna. Thank you, everyone, for listening.
Yeah, I would like to, Natalia, thank you for saying that. Thank you for very much for all the incredible work you do for our community. I think that's to you, Jay. What I am going to do right now is just give a couple of quick updates before we end today. So many of you know we do this on a monthly basis. And so our October presentation will be coming up before you know it. And that one will be on October 23rd at 10 a.m. That one's going to be about breast and liver cancer awareness. And I invite you all to join us for that. We will have Memorial Sloan Kettering out as our presenter. So we're looking forward to hearing from Barbara and their team. And the other few updates that I have is that we have some really great events happening this Saturday in Freehold at the Freehold Family Health Center, which also happens to be our office. In the parking lot, we have vaccines and veggies happening from 10 to 1. We invite people who want to come out and be an exhibitor with us, there's still time. So if you have interest, please feel free to contact me directly. We're going to have Central State and the health department out doing vaccines. We'll have a mobile food pantry, compliments of Twin Pond Farms, and lots of other really good social determinants of health type education type programs. CEED will be there as well, promoting screenings, and we'll have other different types of screenings like lead screenings, vision screenings. So we invite you to come out if you're able. The other event that we have, which will be happening on October 13th, which I would like to just draw attention to the fact that it is on a Sunday, is going to be happening at Town Square in Lakewood. It's the event we've been hosting for a couple of years now in the fall called Wellness Rocks. Again, 10 a.m. to 1 p.m. Again, looking for people who want to come out and exhibit with us. So feel free to shoot me an email or a message if you have interest. We can get you set up to do that. I see a couple of things coming into the chat, so let me just catch myself up. Okay. Yes, thank you, Barbara. Barbara's saying that her docs will be looking forward to doing the presentation in October. We're looking forward to meeting them and having them. Thank you. Okay. I'm going to do one last call for questions for Giovanna before we end, and please feel free to take yourself off mute or write it into the chat.
I don't have a question. Hi, everybody. This is Raven. I don't have a question, but then if possible, I'll be able to soon have something for you to hand out or email out of our breast screening updates. Our breast screening event. Can you guys hear me or no?
Yeah, we could hear you, Raven, but you're a little low. So I could hear something about breast screening events. You want me to mute you and call you on your cell phone? Would that be easier?
She's been having issues with her sound all morning.
Okay. Right here, I'm gonna let's see if she put we have breast screening events. Oh, Giovanna, do you have or anybody who's from CEED here, does anybody have an update about any breast screening events that you would like to promote? I think that's where she's going with that.
Yes, we have several events coming up, both with RWJ and Central State, Monmouth Medical Center, Community Medical Center, um, and Jersey Shore Imaging in Neptune. I think Raven said she was going to send you the specific dates so you could hand them out. I don't know them off the top of my head, but most of them are between the second and third week in October.
Excellent. I know CEED definitely does. It has a huge showing of different types of screening events for Breast Cancer Awareness Month. So I think that's what we're looking to promote here.
Hello, this is Lady. I'm from Monmouth Medical. Our events are going to be on Tuesday, October 22nd for Long Branch, and then the 23rd for Monmouth South.
And that's
Those are all,
collaboratively with CEED, Lady?
with CEED, yes. So they're all CEED patients. So we block the schedule just for CEED patients. And we're gonna have information, like they're all gonna have vouchers and giveaways and things like that.
Wonderful.
Thank
And
you, lady. I
October
was trying to
15th,
pull up the calendar and I couldn't get to it.
October 15th for Community Medical Center in Toms River.
Yes.
Okay, so if anybody here has a family that could use a screening, please get in touch with us and we can direct you to those dates that were just mentioned by Edna and Lady. This way we can put them.
And we have a flyer already done for Mammoth Medical, so I can forward you that so you can share with everybody. The one for community, we still waiting for it, but hopefully this week we're gonna have that one done.
Excellent. Thanks, Lady. Yeah, if you do share that, I can blast it out to the whole coalition. Thank you.
And Jenna, I would just like to ask for this event if Crossroads for Hope can show up to provide pre-cancer support programs. If anyone at this event is interested or need the support, we can provide that as well.
Are you talking about the events that I mentioned that are happening in the community, or are you mentioning the screening events that Lady and Edna were talking about?
Both. Yeah, because if I'm available, I can tag along to like provide information on how people who need cancer support programs can, sign on to the programs that we offer.
Okay, so I can speak definitely from the Wellness Rocks and the Vaccines and Veggies events perspective. Yes, we'd love to have you. So come if you're able. As far as the screening events on site with our hospital partners, I'm not sure how restricted we might be. I know at one point because of COVID, so I would let them talk directly to having different partners be on site for that.
Yeah, maybe if you can shoot me an email so I can forward it to my supervisor and then get in touch with her about that. Because probably you can get in contact with one of the clinical navigators that will be more helpful.
All right,
Okay.
lady.
So, lady, I think you put your information into the chat box, right?
I did, yeah.
Yeah. Okay. So that's great. And then Jen has her information there as well. You guys are like right on top of each other. So that's perfect.
Okay.
If you guys want to connect offline, that'd be awesome.
Thank you.
Thank you. All right. Any last questions or comments? Oh, gee, would you mind putting the last link? I couldn't find it on my end for you had the New Jersey seed link on the bottom of
Sure,
your
yeah.
references.
I'll put it in the chat.
Perfect. Okay. Thank you for doing that. All right, so that's the list of seed sites across the state. Of course, we have the team here that covers Ocean and Monmouth County, so we're good there. But if you belong to another coalition or if they have a need in another county, that's where you would find it in that link that Joanna just sent. And then finally, the link that I just sent, if you wouldn't mind copying, paste, and put it into your browser to just let us know some feedback on your experience working with us. Are these presentations helpful? Could we use improvement in any area? We would love to hear from you. So please feel moved to share, good, bad, or indifferent. We'd love to hear your feedback. Thank you guys so much for joining. Again, thank you, Giovanna, for being our presenter today. And we look forward to the next one that we'll do together on October 23rd with MSK. Thanks, everyone. Take care. Have a great day.